Okay, question number 3. What happens if I eat gluten? And this is the caveat to this question is, if I am gluten sensitive, what happens if I eat gluten? So what is actually the mechanism of what happens when being exposed to gluten? So I've got a nice diagram to kind of break it down for you. This is a simplified diagram, and this is an oversimplification of basically what happens. So what happens, you're gluten sensitive and you eat gluten. Okay, mechanistically, biochemically, this oversimplified diagram is a breakdown of what happens. So first, it's important to understand that gluten sensitivity is not a disease so much as it is a state of genetic predisposition. So think of it as, you know, if you have the markers, genetic markers, you are predisposed for this to occur. And so what happens is on chromosome 6, you have these genes, and then they code for an antenna that sits out on the surface of your immune cells. So this is a white blood cell, an immune cell. And so again, HLA-DQ genes code for the production of this antenna. Now it looks like a kind of a Pac-Man shape, right? Just facing up. But what happens is this receptor, when gluten comes in and sits into this receptor, what happens is you get a reaction. And there are different kinds of reactions, but the gist of it is when gluten binds to this receptor, it triggers an inflammatory response. And that inflammation is what happens that creates the damage. So this inflammation, by the way, if it occurs in the small intestine and it causes enough damage, this is going to generally be diagnosed as celiac disease. Now, if this inflammation occurs, let's say in the skin, there's a condition called DH, dermatitis herpetiformis, that we might see manifest. Now, if this inflammation occurs in the liver, you can get a diagnosis of autoimmune hepatitis. If this inflammation occurs in joints, there's overlap with gluten causing rheumatoid arthritis and other forms of autoimmune arthritis. So the gist is the gluten exposure triggers an inflammatory response that leads to damage, and the damage, wherever it occurs, is unique to the individual. Everybody has their own unique set of responses. Not everybody is going to react to gluten by manifesting a celiac conundrum. So this is a more complex looking diagram. So I want to give credit where credit is due. Dr. Aristio Vijani, very intelligent, very bright PhD doc who is an immunologist, but he created this slide. And so basically this is just a more complex diagram. If you look right here, you see those that term HLA DQ2, DQ8. Okay, that's the genetics. That's the genetic predisposition we were just talking about. You can see this, what looks like a little purple Y structure. That's the HLA DQ receptor that we were just talking about. So again, going from complex looking diagram to a more simplified looking diagram, the simplification here, right? So that same receptor is this receptor. So now what happens, you can see here these little green circles, that's gluten. Okay, so gluten can basically break through the gut lining. It creates holes or damage to the cell lining and causes what's known as increased permeability, oftentimes referred to as leaky gut. This is one of the side effects of what gluten can contribute to. And so once the gut's leaking, you get these little proteins, these little gluten proteins start leaking through. And so when they leak through, okay, one of the things that happens, you have a specialized type of white blood cell called a dendritic cell, and the dendritic cell will bind that gluten and it will take it over to the immune cells, to a mature dendritic cell. This HLA-DQ receptor then receives that gluten and then it presents it to another type of cell called a CD4 cell. So again, this gets super complicated, which is why I oversimplified it. But there are two main kinds of reactions that you can get. You can get what's known as a Th2 reaction, which is a B cell, a specialized type of white blood cell, and you get the production of antibodies. Okay, you can also have what's known as a Th1 reaction, where you get the production of these chemicals that are inflammatory in nature, chemicals like TNF alpha and interferon gamma. are examples of that. And then these chemicals and antibodies cause mucosal destruction and epithelial cell damage, which further contributes to the autoimmune problems. And this is why when people have autoimmune disease, one of the most likely culprits is actually gluten. That's why gluten is linked to so many different types of autoimmune disease. Again, so this is just a complex reality of what happens when you eat gluten. Gluten causes leaky gut. It penetrates through the gut wall. It interacts with the immune system. The byproduct of that interaction is to produce antibodies or to produce inflammatory chemicals. These reactions then create inflammatory damage to multiple tissues within the body. It's not just limited to damaging of the gut. So, in a nutshell, that's what happens when you eat gluten. That's the damage. Now, we've got a link here for if you want to go learn more about gluten damage and how long it takes to get rid of gluten damage and how long it takes to get gluten out of your system. I've got a full comprehensive breakdown of that for you there. Now, we would be remiss to not also talk about non-gluten components of grain that cause inflammatory damage, because so many people question whether or not they're gluten sensitive, and some people aren't gluten sensitive, but what they're reacting to are other things in the grain. This is why I wrote No Grain, No Pain. It was to discuss the rest of what happens, right? So we get what else is in grain that can cause damage besides gluten. So we have gluten here, right? But we have all these other things that are found in grain. So heavy metals, excessive omega-6. We know that grains directly can cause leaky gut. We know that they're comprised predominantly of excessive carbohydrates. We know they have many of them are genetically modified, and they contain pesticides, and they contain mycotoxins as well as molds. So molds are basically the parents of mycotoxins. And then they contain these other proteins called ATIs, amylase trypsin inhibitors. And so these other aspects, let's just cross gluten out. Let's say we have these other factors in grain that we also know can cause chronic inflammation and pain. And one of the main mechanisms that occurs as a result of those other elements has to do with in your gut called a TLR4 receptor. So a TLR4, this stands for toll-like receptor. These are little tiny receptors that line the GI tract. And so when you're exposed to things like molds and mycotoxins or ATIs, which are again proteins predominantly found in grain that aren't gluten, when you're overexposed to omega-6, these things will trigger an inflammatory response through engaging this aspect of the immune system. So this is not an antibody. So some people, when they go get tested and they don't test positive for antibodies for gluten, it's because when they eat grain, this is what's happening. And so their test is going to come back a little bit construed and confusing. So again, these are other elements within grain that can also drive inflammation through TLR receptors. It's important that you understand that, because it's important that you understand that the testing for gluten is not always accurate for many different reasons, but sometimes it's accurate, but you still do better on a gluten-free diet. Because this is another follow-up question that we get is, I tested negative for celiac disease, but I feel better when I don't eat grain. Why does that happen? This is one of the big reasons why that happens.